I live in a small town, a community of 9,000, and our hospital uh, has been the hub for caring for individuals with COVID, with other exacerbating conditions caused by COVID or otherwise. And the impact on us as a hospital, on our workforce, and frankly on our community is long lasting. We are now looking at 2.5 years later at how do we move forward post COVID in a healthcare world and in a financial world that's changing dramatically. I know that reimbursement has always been a challenge before COVID for years now, especially rural hospitals that are not critical access. They're getting reimbursed from Medicare and Medicaid at 70 cents on the dollar. So they're immediately losing money when they have someone who is suffering and lives in poverty or who's elderly. The hospitals and the doctors that care for them are losing money. So that issue of reimbursement has been a tremendous challenge. Add on to that all of the elements of COVID that have come with it, the response, the reaction, the investments that had to be made. Certainly, some of the federal investments through the CARES Act and more were helpful in the short term. Now we're starting to see maybe that timeline is shortening. In our state, we heard last week that we're losing a hospital at the end of the month. And that first hospital in our state to close in many, many years is a shocking and saddening moment for us. And we can reflect on what could they have done differently. And the answer is they probably couldn't have done much because they couldn't change that reimbursement structure. I think we need legislators at the federal and the state level to recognize that healthcare is so complex that there aren't easy fixes, but that it does take a willingness to be collaborative and recognize that you can't say, well, we're going to make an investment here, but we have to make a cut someplace else so that it's budget neutral, so to speak. There have to be strategic investments, and those investments shouldn't come with accompanying cuts just to balance the budget. It costs money to deliver quality health care, and it's going to take not just the institutions and the providers, but the policymakers working together to make that happen.